Coronavirus definition. Globally, approximately 170,000 confirmed cases of coronavirus disease caused by the 2019 novel coronavirus have been reported, including an estimated of 7,000 deaths in approximately 150 countries. On March 11, 2020, the World Health Organization declared the COVID-19 outbreak a pandemic. Data from China have indicated that older adults, particularly those with serious underlying health conditions, are at higher risk for severe COVID-19 associated illness and death than are younger persons. Information of pregnant women with COVID-19. From December 8, 2019 to March 20, 2020, we identified 118 pregnant women with COVID-19 in Wuhan according to the criteria of the Chinese Clinical Guidance for COVID-19 Pneumonia Diagnosis and Treatment. 84 women had positive polymerase chain reaction testing for severe acute respiratory syndrome coronavirus 2, and the remaining 34 had suggested findings on computed tomography of the chest. The median age of the woman was 31 years. 55 of 106 were nulliparous, and then 75 of 118 had been infected with SARS-CoV-2 in the third trimester. The most common symptoms in 112 women with available data were fever in 75% and cough in 73%. Lymphopenia was present in 51 of 116 patients. A total of 88 of the 111 women who underwent chest computer tomography had infiltrates in both lungs. A total of 109 of 118 women had mild disease, and 9 had severe disease, one of whom received non-invasive mechanical ventilation had critical disease. Severe disease developed in 6 of the 9 women after delivery, and the woman who received non-invasive mechanical ventilation did so after delivery. As of March 20, a total of 109 of 116 women had been discharged, including all women with severe or critical disease. There were no deaths. Pros. Testing for SARS-CoV-2 was performed on neonatal throat swabs of 8 newborns and breast milk samples of 3 mothers. No positive results were reported. The risk of severe disease in our pregnant population compared favorably with the risk reported in the general population of patients presenting with COVID-19 across mainland China. The present data do not suggest an increased risk of severe disease among pregnant women, as has been observed with influenza. Cons. The exacerbations of respiratory disease that are observed in women during the postpartum period are likely to relate to pathophysiological changes, for example, increased circulation blood volume, that occur in this period. Among the study population, there were 3 spontaneous abortions, 2 ectopic pregnancies, and 4 induced abortions, all owing to patients concerned about COVID-19. Management of pregnant women with COVID-19 symptomatology. Perform diagnostic confirmation tests for COVID-19, both laboratory as a priority image and without delay in the pregnant woman. Use protection to decrease fetal radiation exposure. Maintain home isolation and control through information technology and communication in patients with mild symptoms of COVID-19 with or without comorbidities. Hospitalizing care units defined for patients with COVID-19 positive to pregnant patients with pneumonia. Patients should be hospitalized in gyneco-obstetric hospitals if you are in labor or there is an associated comorbidity classified as an obstetric emergency as preeclampsia or restriction of fetal growth. Conclusions. There are limited data about the clinical characteristics of pregnant women with the disease. Among the study population, there were 3 spontaneous abortions, 2 ectopic pregnancies, and 4 induced abortions, all owing to patients concerned about COVID-19. A total of 14 deliveries, 21% were premature, 8 were induced, 7 owing to concern about COVID-19. No baby had neonatal asphyxia.
Hey everyone, this video has been exclusively made to address the concerns of pregnant and breastfeeding women infected with COVID-19. If your sister, your daughter, or your wife is pregnant, share this video with them, which will help them relieve their anxiety regarding pregnancy and breastfeeding during the coronavirus disease crisis. The sole purpose of this video is to clear any doubts that might be lingering around with the little knowledge that we have about COVID-19 and its effects on pregnancy and childbirth, and also its effects on breastfeeding infants. I know a lot of you may have a lot of questions while the COVID-19 is rampant. I will do my level best to address your concerns and will keep you updated with the latest recommendations as and when they become available. In a small study in pregnant women with COVID-19 pneumonia, intrauterine transmission, which in its literal terms means the transmission of the virus to the baby while in the mother's womb, has not been found, and no maternal deaths have been documented as yet. However, there appears to be an increased frequency of preterm labor, which is the possibility of delivering the baby before the completion of 9 months, and cesarean delivery because of abnormal fetal heart rate tracings, which actually can happen during any fever-producing illnesses, and COVID-19 is no different. This occurs in cases where the mothers are severely ill. Pregnancy and childbirth did not worsen the course of pregnancy in these patients who've been studied. Some mothers have also recovered without undergoing delivery also. And the approach towards prevention, the evaluation, diagnosis, and management or treatment of these pregnant women with suspected COVID-19 should be similar to that of any non-pregnant individual. It is unknown whether the virus can be transmitted through breast milk or not. The only report of testing we have at hand found no virus in the maternal milk of 6 patients. However, droplet transmission could still occur through close contact during breastfeeding. So the mothers with confirmed COVID-19, or even those who are symptomatic and are suspected to be having COVID-19, should take precautions to prevent transmission to the infant during breastfeeding. And this includes hand hygiene and the use of face masks. Alternatively, to minimize the direct contact, the infant can be fed by expressing breast milk by another caregiver until the mother has recovered, provided that the other caregiver is healthy and follows hygiene precautions. In such cases, the mother should use strict hand washing before pumping and wearing a face mask during pumping. And if possible, the pumping equipment should be thoroughly cleaned by a healthy person. And women who choose not to breastfeed must take similar precautions to prevent transmission through close contact when formula is fed to the infants. Encapsulating all the discussion that we've had in this video, in summary, I'd like to comment on a few important things based on the available clinical and research data we have. The clinical characteristics of patients with COVID-19 infection presenting from mid trimester onwards are similar to those of non pregnant adults. Currently, there is no evidence that pregnant women are more susceptible towards COVID 19 infection, and that those with COVID 19 infection are more prone to developing severe pneumonia if they're pregnant. We do not have any evidence to prove that. There's also no evidence of vertical mother to baby transmission of COVID 19 infection when the maternal infection manifests in the third trimester. And lastly, we, the Procyon Private Limited family, would like to pay our tribute to all the frontline medical professionals who are working tirelessly to bring the COVID 19 epidemic under control. To all those frontline health workers around the globe who are working against COVID 19,